Hello everyone, I am Dr. Somasundaram, working as a consultant neurologist in Apollo Greaves Road, Chennai and Apollo Specialty Hospital, Tenamed. I treat all neurological ailments ranging from headache to stroke, and my special areas of interest will be migraine and stroke, since that forms the bulk of the patients that I see in my daily practice every day. So regarding migraine is one of the most common cases that I see in everyday practice. So migraine is a disease which is fully curable. There are a lot of news, there are a lot of bad propaganda going on that migraine is a lifelong condition. It needs lifelong medication. It cannot be cured. It cannot be cured with medications at least. And there are lots and lot of bad propaganda going on regarding migraine. But migraine is a fully curable condition, and it can be. There are patients who have been completely off the medications and without headaches for a long period of time, in spite of having a very severe form of headache when they presented with me in the first place. So regarding migraine is a pain syndrome. That is what we need to understand. Like the term migraine may seem something very foreign, and it may seem like a very complicated medical condition. But migraine, if you put it in a very simple perspective, it is just a pain syndrome where you feel pain in response to something in your body. So pain is, we always see any pain as our enemy, but actually pain is your friend. Pain is something which tells you, the pain is the way your brain and your body tells you that it doesn't like you doing something. That is what is actually, pain is your friend. For example, you put your finger into a fire, there will be intense pain. That pain prevents you from doing that again. So pain has been built in our nervous system. Pain is built in our brain for a reason. That is to prevent us from doing something, from harming ourselves, from harming our brain, harming our mind, and harming our body. So thanks to the very busy lifestyle that we have, which has been forced upon ourselves, at least in the past few decades, because of a highly busy life that everybody leads, migraine has become very, very common. So what are the reasons? What are the basic reasons for migraine? I'll put among all the patients I see, the brunt of the blame, I'll put it on our lifestyle. Not sleeping 8 hours in the night. There is a myth going around that sleeping 8 hours, just sleeping is just wasting your time. There are several people who say that if you sleep more, you are a lazy person. Like sleep is not required. Sleep is for for kids, and no sleep. Adults don't sleep. These sorts of myths are all going on. But sleep is very, very essential part of how our brain functions, our mind functions, and how our body functions. If you don't sleep 1/3 of your time, that is, if you don't sleep 8 hours every night, obviously you have to pay. You have to answer your body, you have to answer your brain with headaches. The way the brain and your mind and your body reacts to inadequate sleep is headache. So that is the way your body conveys that what you're doing is not right. So lack of proper sleep. It should be 8 hours, and the ideal sleeping time is 10 p.m. to 8 a.m. It can be plus or minus 1 hour, but you cannot say that I sleep from 3 a.m. to 11 a.m. and say that I've had 8 hours of sleep. That doesn't work. 10 p.m. to 6 a.m. is the ideal sleep time. Maybe plus or minus 1 hour depending on your schedule. So sleep 8 hours a night. And one more thing, it should be as a full chunk. You should not segregate it into smaller sleeps, and you say that I sleep 8 hours for every 24 hours. It doesn't work that way. I sleep 2 hours in the afternoon, 1 hour in the evening, and I sleep for 5 hours in the night. That doesn't work. The brain doesn't work that way, because you will never be able to hit deeper stages of sleep with such a fragmented sleep. So there are sleep as an architecture. You have to go from stage 1 NREM sleep up to stage 4 NREM sleep. Then you have to go for REM sleep. The entire cycle takes around 2 hours, and every night you go around 3 to 4 cycles of such sleep. So that entire architecture is very important for migraine prevention. Not only for migraine prevention, bad sleep has been associated with all the diseases, right from common cold to cancer. improper sleep has been proven to be a carcinogen. It can also cause cancer. So good sleep is not only good for your migraine, it is good for everything right from common cold to heart attacks to cancer, everything, and it improves your memory and performance as well. So next thing that I hear across from many patients is that they take a lot of coffee and tea that helps with their headache. Actually, that is also not true. And coffee and tea, in fact, have been proven to cause further headaches. If you have a headache, if you take coffee, you feel good. But obviously, you should also understand that the next headache is also because of your coffee that you are taking now. Caffeine withdrawal. And we term these chemicals as methyl xanthines, caffeine and theophylline, coffee and tea. These are proven to be bad triggers for migraine. Please do avoid them. Coffee and tea can give you a short-term relief, but they are going to make a migraine patient for a longer time. You are going to stay on medications for a longer time if you take coffee and tea for a short-term gratification. So next thing, and obviously the same goes with alcohol, smoking, tobacco chewing, and even chocolates. These are all known triggers for migraine. Coffee, just remember, coffee, tea, chocolate, alcohol, and smoking and tobacco chewing. These are all the triggers that you have to obviously avoid. The next thing will be eating 3 times daily. Don't skip your breakfast, lunch or dinner, and don't postpone your breakfast, lunch or dinner. That is also known to precipitate headache attacks. Eat 3 times daily. Eat a healthy food, lot of vegetables, lot of water. Dehydration is a known factor for migraine. Don't go out in the sunlight. Sunlight is a trigger. Don't listen to loud noises. Don't use headphones. Avoid loud noises. That is also a known trigger. And strong smelling perfumes, strong smelling flowers, agarbattis, these sorts of incense sticks, all these sorts of things which cause a strong odor, you should avoid. This is what we medically term it as photophonoosmophobia. That is, these migraine patients usually have intolerance to light, that is photophobia. Phonophobia is intolerance to sound and noises, and osmophobia is intolerance to smell. All these are triggers. If you keep doing that every day, if you expose yourself to loud noises, bright light, and intense smelling things every day, obviously you're going to be on migraine medications for quite a long time. And so these are the very basic ways. These are the very basic lifestyle changes you need to do. And I've seen among the patients I see, just with lifestyle changes, almost 80 to 90% of the patients do improve. In fact, without medications, it seems like magic to them, but it is quite simple. If you are a migraine patient, please make a note of these things and please follow these things. And in fact, your headache will become so low, the intensity will become so low, or the frequency will become so low that you may not need medications at all. Just with lifestyle medication, it is like magic. So regarding the medication, there is one more myth that if you are put on migraine medications, you should take these medications lifelong. Obviously, that is also I will say a big no to that as well. Medications will be required depending on your lifestyle. If you follow whatever I said from top to bottom, if you follow whatever lifestyle I told you to the T, obviously you will be on the shortest possible course of migraine medication, and I will be tapering your medication as quickly as possible. You will be off the medication depending on your lifestyle, obviously. So these are the very important things that you need to understand. And more than that, regarding the complications of migraine, one thing that I want everybody to understand is very few patients, I can just count with my fingers in the past year that I've seen any complication of migraine happening. So that stress that you have something serious or something is going to happen to me, the sense of impending doom that many people have if they have a headache, that is uncalled for. That is what I will say. Very few patients land up in complications, very few patients, and that too among those very few patients who land up in complications, very few patients land up in serious complications like stroke. So you can be, and why I want you to understand is, stress is also another important factor for migraine. If you keep stressing yourself that you have a very serious disease, that is why you are having such a bad headache, you are going to increase your stress levels, and that is going to put you on medications for a long time. That is going to force me to put you on medications for a long time. So avoid stress as much as possible. Go for some meditation, yoga, enjoy your time, like go out with your family often, go to resorts and take a vacation often. That also is one of the main treatment plans that I tell my patients. That seems to work. Maybe once in every 3 months, go out on a vacation. Maybe once in every 2 weeks, take a weekend off. from your work. That will also help with your headaches. So to put everything in a nutshell, migraine is something which can be cured just with lifestyle. You can cure yourself. You can have 100% resolution of your migraine just with lifestyle modification with little or no medication. That is what I will say. And everything depends on your lifestyle.